Yeah, the meeting is now live.
Thank you. Good morning and welcome to the Health and Wellbeing Board. I'm Dr. Linda Colley of the Portsmouth Clinical Commissioning Group and I'm chairing the meeting today. Members of the public are invited to view this meeting and there has been the opportunity for written representations to be submitted. Board members are requested to keep their microphones on mute and to only turn these on when they are called to speak. To indicate that you wish to speak, please either raise your hand or pop your name in the chat function. Please only use the chat function to indicate your wish to speak with no other comments, as the members of the public will not be able to see that. Before we move on to the actual main agenda, I would like to announce some membership changes and to welcome some new members. So as you're aware, since our last meeting as a board, there have been local government elections. The previous co-chair, Councillor Matthew Winnington, is no longer in his post as Cabinet Member for Health, Social Care and Wellbeing. So I'd like to record the thanks of the board for his work on our behalf and welcome to the board the new Cabinet Member, Councillor Jason Verzakli, who will assume the chair of this meeting later in the year. In June 2019, we also agreed to broaden membership against our terms of reference and ensure cross-party representation on the board beyond that specified. So I would also like to welcome new members of the Health and Wellbeing Board from the other political groups on the local authority. It's been suggested to us as a board that we could strengthen our links to the safeguarding boards in the city by providing the opportunity for safeguarding chairs to receive papers and participate in discussions at the board if they wish by co-opting them as members. Unless anyone has a particular objection, I will confirm their membership of the group. Are there any objections to this? Lovely. There is also some changes in membership from the CCG, and we also have new representatives from the Portsmouth Education Partnership following the retirement of the previous representative, Steve Lebitz. Again, thanks to him for his work with the board. So with all of those changes in mind, can I welcome you to the session, and we'll actually start with a round of introductions so that we can all learn the new members. So I'm just going to do it via my list that I've got on my side here. So if we start with Bernie Allen.
Hi Linda and everybody else. My name is Bernie Allen. I'm the Deputy Director of Planning Analytics. I was here really to shadow and observe the first part of the board today, so thank you very much for the invite. I've been working with Kelly to see how we can align our work, so that's why I've been invited today. Pleasure to meet everyone.
Thank you. Helen Atkinson.
Thank you, Linda. I'm Helen Atkinson. I'm the Director of Public Health for Portsmouth.
Thank you. Saima Begum.
Hi, my name's Saima. I'm the new domestic abuse analyst for those who are in safe accommodation, and I'm just here to shadow.
Thank you. Welcome. Andy Biddle.
Thank you, Linda. Morning, colleagues. My name's Andy Biddle. I'm the Director of Adult Social Care at Portsmouth City Council.
Councillor Verzakli.
Yeah, hi, thank you, Linda. You already partly introduced me. Good morning, everybody. My name's Councillor Jason Verzakli, the recently appointed member, Cabinet Member for Health, Wellbeing and Adult Social Care. So I look forward to meeting you all.
Thank you. Councillor Gosling.
Good morning. So I'm the Conservative Cabinet Member for Health, Wellbeing and Adult Social Care.
Thank you. Matthew Gummerson.
Good morning, Matthew Gummerson. I'm the Strategic Lead for Intelligence in Public Health Portsmouth, here to introduce the item on the Health and Wellbeing Strategy.
Thank you. Anthony Harper.
Good morning, I'm Anthony Harper. I'm the Head of Integrated Children's Commissioning for Portsmouth CCG, Portsmouth City Council. I'm here to introduce the item on the Children's Public Health Strategy.
Thank you. Councillor Horton.
Good morning, everyone. I'm Councillor Susie Horton. I'm the Cabinet Member for Children, Families and Education.
Thank you. Alison Jeffrey.
Hello, everybody. I'm Alison Jeffrey, Director, Children, Families and Education at the City Council.
Claire Jenkins.
Good morning, everybody. I have poor Wi-Fi, so I apologise now. I'm Claire Jenkins. I'm the District Commander for Portsmouth Police.
Sorry, I lost the connection there myself. Jim Couch.
Yeah, morning everyone. I'm Jim Couch. I'm the Station Commander at Southsea Fire Station. I'm here to represent Hampshire Wildlife Fire and Rescue Service.
Thank you. John Knighton.
Morning everyone. John Knighton, Medical Director at Portsmouth Hospitals, QA on the Hill. Hi.
Hi. Dominic Latouze.
Good morning, everyone. I'm Dominique Latouze, Consultant in Public Health. I'm here to introduce the item on air quality today.
Thank you. Mark Sage.
Morning, everyone. I'm Mark Sage. I'm Portsmouth City Council's Tackling Poverty Coordinator. I'm here as a supporting officer for the item on the health and wellbeing strategy.
Thank you. Anna Martin.
Anna Martin, Democratic Services.
Thank you. Amanda Mackenzie.
Hi, Amanda Mackenzie. I'm a public health principal here around the 0 to 19 agenda.
Councillor Mellor.
Morning, everybody. I'm Councillor Kirsty Mellor, Labour Opposition spokesperson for this board.
Welcome. Kelly Nash.
Hello, I'm Kelly Nash from the Strategy Unit here at the City Council, and I provide general support to the Health and Wellbeing Board.
Nick Moore.
Hi, I'm Nick Moore. I'm a GP at Portsmouth, and I'm a clinical executive on Portsmouth CCG.
Thank you. Jackie Powell.
Morning, everyone. I'm Jackie Powell. Morning, one of the lay members for Portsmouth CCG.
Thank you. Roger Batterbury.
Good morning, everyone. I'm Roger Batterbury. I'm the chairperson at Health Watch Portsmouth.
Thank you. Susanna Rosenberg.
Good morning, Susanna Rosenberg, Chief Operating Officer for Salem NHS Trust.
Councillor Smith.
Good morning, everyone. I'm Councillor Jeanette Smith, and I'm an independent member on this board, and I'm not new to it, so I was on it previously.
Thank you. Jo York.
Hi everyone, I'm Jo York. I'm Managing Director for Health and Care Portsmouth, a joint role between Portsmouth CCG and the City Council, and here today deputising for Maggie McIsaac, the CCG Accountable Officer. Thank you.
Thank you. And I've just noticed David Adams at the top of my list.
Good morning, David Adams, Lead Interventionist, Portsmouth City Council.
Thank you. And Hayden.
Morning, everybody. Hayden James, Assistant Director for Children.
Lovely, thank you. Now, I think I got everyone. Was there anyone that I've missed? Please raise your hand if there is. No, lovely, thank you. So, Anna, did you want to report the absence? Apologies for absences, please.
Yes, I've got Sarah Beattie, Probation Service, Penny Emmerich from Portsmouth Hospitals Trust, who's represented by John Knighton, Sue Harriman from NHS Solent, represented by Susanna Rosenberg, Frances Mullen of Portsmouth College, Diane Sherlock, Age UK, David Williams, Portsmouth City Council, Andy Biddle said he had to leave at 11:15, and Alison Jeffrey said she might have other commitments. Lisa Wills is joining nearer her item, Changing Futures.
Lovely. And did we hear just at the beginning there that Councillor Vernon Jackson? Apologies.
Oh, yes, so Councillor Vernon Jackson's apologies as well.
Yeah, lovely. Thank you very much. So is there any declarations of interest for anyone on the agenda items today? Oh, Kirsty and Jeanette.
Yeah. Thanks, Chair. Yeah, I'd like to declare a personal interest in agenda item number 10, the Guildhall Walk Healthcare Centre. I am a patient there. However, I don't feel that I should be precluded from any active participation in the meeting. Thank you.
Thank you. And Jeanette Smith?
Yeah, my normal pecuniary interest, I am full-time employment with Hampshire Unison as a rep there. So I'm in paid employment. So if anything comes up that involves Unison, then I might have to withdraw, but there's nothing on the agenda at the moment.
Thank you. Nick?
Yeah, same with the item for Guildhall Walk as a GP in another practice that probably will receive patients when this list is distributed. I'm declaring an indirect interest, but I'm an employee of another practice.
Yeah, and I should declare the same as a GP partner in one of the practices in the city then. Okay, was there anything else? Lovely, thank you. So we move on to the minutes of the previous meeting. Has everyone got a copy of these? So this was from the 3rd of February, and we'll just go through them for accuracy. So page 1, page 2, page 3, page 4, page 5, and then page 6. Sorry, that's my piece of paper. So do I have a proposer to say that these are the correct record of the meeting?
I'll propose that.
Thank you. And does anyone second?
Yeah, I'll second.
Thank you. So the recommendation has been proposed and second. I will now take the vote by affirmation of the meeting as permitted within the regulations. If there is no dissent, the proposal is passed. Are there any objections to this recommendation? No, lovely. The minutes of the previous meetings have therefore been approved. So, are there any matters arising from any of those minutes? No, lovely. So we'll move on to Joe York then, and the Health and Care Portsmouth update from place-based partnership event. Joe.
Thank you. Yes, I was just asked to come and just give a brief update on where we've got to following the event that we had on the 16th of June and also the wider ICS development. So we had a Portsmouth City event supported by the LGA, the Local Government Association, on the 16th of June. That was with many members of this board. So the invites went to the Health and Wellbeing Board membership and our operational delivery group for health and care, one of our operational delivery groups for health and care Portsmouth Provider Partnership, which is a partnership arrangement where the primary care in the city, so the Portsmouth Primary Care Alliance, the PCN, so GPs through their primary care networks, come together with Solent NHS Trust and the local authority, predominantly from adult social care, but more recently including children's social care and public health in the council. We're all on that board, as well as the CCG and the Hive. And this was the purpose of the event a couple of weeks ago, was to look at what do the place-based arrangements within the set out within the Innovation and Integration White Paper for changes to the NHS functions and the setting up of integrated care systems as statutory bodies to replace CCGs from April 2022. The event was to look at what does that mean for us locally in Portsmouth, where are we at with the national agenda, but also how would we want place-based arrangement to look in the city as part of Hampshire and the Isle of Wight ICS. And I think the report of that event was produced for us by the LGA. That came out yesterday, I believe, so won't go into it in huge detail, but I think everyone felt it was a really positive event. It was an opportunity for us to really reflect on what place meant to us in the city, a really strong sense of that commitment to Portsmouth and the partnerships within it, how we work together, but also that we need to continue to work at all levels, not, in order to get the best for the residents of the city, we need to work across many partners in health and social care, both within the city as we do, and we have a long history of, but also across Portsmouth and South East Hampshire to support particularly the acute hospital, but also to take a really active and proactive role within the ICS, of which we are a part. So it was a real commitment really for us to think about what principles, what would that look like for us in the future, and then to start thinking, how do we do that? The next steps we've agreed, say the LGA wrote up the slides for us, they've gone out to partners that were there, and then to start thinking around some options around what would this look like in the future, how can we do that, what would our place-based arrangements look like within the ICS. It's likely from the discussions we've been having within the ICS and as we discussed on the day that we'll be required to set out an MOU, a Memorandum of Understanding with the ICS around that delegation to place. So we're looking to convene the wider group again the week commencing of the 26th of July to look at what that might mean and what some of the options might be with us. Obviously, this needs to be done in partnership within the ICS, but we have had those conversations with ICS colleagues to say we're really keen to do this in Portsmouth, to lead the way and to look at what level, how we maximise the levels of delegated authority into the city to ensure that local decision making, but also making sure that we are able to play our part in those other levels and are leading pieces of work and actively engaged on ICS wide pieces of work. So next steps will be towards the end of July to think through some options. We'll then think about at what point does that come back formally to the Health and Wellbeing Board, which it will need to sign anything off in partnership with the ICS. That's where we're at.
Thank you. Any questions or comments? No, we look forward to getting that piece of work back then, Jo. Thank you very much.
Thank you.
Kelly, you're doing the Local Outbreak Engagement Board piece, is that right?
Yeah, happy to. Thank you, Dr. Colley. So the paper that is attached to the usual brief summary of the work of the Local Outbreak Engagement Board since the last time this board met, and a number of members of this board are also on that, so they'll be very well placed to comment as well. In paragraph 4.2 of the report, there's a list of the business that has been completed, and you'll see a particular note is the refresh of the local outbreak management plan, which had to be completed according to new requirements. We've also attached a copy this time of the regular assurance report that the board considers, and that gives you an up-to-date, well, an up-to-date as of the last meeting, which was at the end of June, position in the city, and also highlight some of the key risks, which are also noted in the main body of the report. And we'll continue to bring these regular updates back to the Health and Wellbeing Board for as long as the mechanism remains in place. So, as I say, other members of the board are here as well and will be very able to comment should you wish to, but I think obviously mindful of the agenda, I'll leave it there and move to questions which I'll be happy to answer.
Lovely, thank you, Kelly. My question was, is there any indication of when it will be ended as a board? With all the changes coming, has there been any move?
No, I think there's something that's obviously an open question, obviously affects the arrangements around the Health Protection Board as well, but it's something we're keeping an eye on, but at the moment there's no plans to particularly change the way of working.
Thank you. Jackie.
Hello, I had a couple of questions, if I may. One was around the case rates, which are RAG rated red in the appendix column, and yet the commentary says that they remain low. Just curious about that. And two was, how effective do we think the test and trace system has been? Excuse me. And is it the only mechanism to apply for self-isolation support? Again, the numbers seem low, and the numbers that actually achieve it seems lower still. So I was just interested in views.
Thank you. I think Dominique is on the call and is possibly best placed to answer the question around the test and trace element. And I think Helen will come in around the infection rates.
Lovely, thank you. Who wants to come in first?
Shall I do the infection rates and then I'll pass over to Dominique for the test and trace? So yes, I think it's a good challenge, Jackie. We, at the time of writing the report and at the time of last meeting, the Local Outbreak Engagement Board, the numbers were significantly lower than they are. So as you'll be aware, we are now at the I think one of my colleagues calls it the foothills of the third wave, and we have been doubling in terms of the infection rate in the city pretty much weekly. So we obviously met a few weeks ago, and that report was produced for that meeting, but we have now seen an increase, as you will be seeing in the media. So yes, the infection rates have gone up, not just in the city, but across the Hampshire and Isle of Wight patch, but also nationally.
Thank you. Shall I come in on test and trace? So we've got, in terms of what we're being asked to do in terms of test and trace, the local team has been very effective, reaching 96% of those that of cases that we're asked to contact, and that's been subsequent to us taking on all cases immediately. It used to be, when we first took on the programme in the autumn, that there was a delay, and that the national team would take on cases and then we would work with them after a period of 36 hours. Now we take on cases immediately, and we've had a really good case finding rate. Having said that, in the last 2 or 3 weeks, as cases have risen dramatically, we're a small team, and we have struggled to meet all of those cases, so we have passed some of them back on to the national team. It still means that we're reaching high numbers of cases to ensure that they self-isolate and that they have all the support they need to self-isolate, and that we identify their close contacts who can also be told to self-isolate. Which brings me on to the second question about self-isolation. The report highlights one aspect of the self-isolation support, which is obviously the financial support, and there's been a lot of discussion in the national press about whether that's and in government about whether that's the best approach to support people, and I understand that approach is being considered in terms of the payment, the £500 payment. In addition to that, we do also have in-kind support, and I know that Mark's on the call in terms of poverty relief and food support for people, and in-kind payments that or in-kind support that we're able to give through the Hive, through things like support to do food shopping or collect medications and so on. So we do have a sort of a range of support for people to self-isolate. We've also got a Foundation 2 doctor working with us at the moment, looking at the pathway for people to self-isolate, so that she'll be able to identify any further needs that we can. But we're restricted in what we can do in terms of the self-isolation payments, because it's very rigorously bounded as a government programme. But in the in-kind payments and support, we're doing as much as we can.
Thank you. Nick.
Yeah, it was just on the in the appendix, there was a mention about the new testing site when the Eldon Street site closes, opening in the Sainsbury's car park. I went past it at the weekend and it still looked boarded up to me. So is that opening, or has it opened?
Yes, it opened on the 26th of June.
Okay, well, I obviously went past the wrong bit of it then in that case, so it is up and running.
It's in the car park of the old Sainsbury's site on Commercial Road. The building itself is being used for another purpose. So the test site for PCR testing, symptomatic testing, is in the car park.
Is that for driving in? Because I just that's the I went. What was it? Is it a walk-in?
It's a walk-in clinic to replace the Eldon site.
I see. Okay, no, that's why the drive-in area is still blocked off. That's why. Okay.
Yeah, there's parking in other areas in the city centre.
Right. Okay, I understand.
Thank you. Any other questions or comments? No, lovely. Thank you, Kelly. That's noted. Helen, I think we're moving on to you next for the Health and Wellbeing Strategy Refresh.
Well, we're actually moving over to Matt, Hayden and Kelly, but Matt's going to introduce it. But I would just like to acknowledge the really fantastic work the three of them have done to get us to this stage where we are presenting the next stage of the development. So over to Matt. Thank you.
Thank you.
Thank you, Helen. Thank you, Dr. Colley. So as Helen says, you'll get a bit of me presenting and then a little bit of Kelly and Hayden as well. There is a report that's gone out with the papers that explains what we're going to cover in the presentation, but we're hoping through the presentation to go through some of that in a bit more detail, and the slides can be made available to you all afterwards. So I shall share my screen now and turn my camera off just to protect the bandwidth. I'll try and keep an eye out for hands, but obviously there'll be plenty of time to take questions at the end. So conscious that we've got a number of members of the board who weren't members of the board when we started this process, which was quite a long time ago. So I will try and go through the background to how we got here, as well as where we're currently at in terms of the draft strategy. And just to highlight at the beginning that the intention is that there are lots of further opportunities for development of this work over the coming months. So this is not a final strategy that we're presenting here. So just a quick recap of the background. Back in early 2020, this board met, and then a subsequent meeting with a few other stakeholders present as well, began discussing the refresh of the health and wellbeing strategy, which is a statutory requirement of the board to agree, and the current strategy runs out in 2021. What we'd started by doing was looking at a number of areas where, as a city, our performance was significantly worse than other places, those areas where we were a real outlier in terms of outcomes. And then as a group, we looked at kind of trying to understand what's underpinning that, those poor outcomes across a range of issues. So the language we use is the causes of the causes. And as a board, you agreed that you wanted to move the focus of the next health and wellbeing strategy to looking at those longer term issues, the underpinning issues, and trying to change the curve on those things to really improve outcomes across the board. And we summarised that in the statement at the bottom of those slides. Having undertaken that work, obviously the pandemic required a significant shift in everyone's priorities in terms of our capacity to do this work and everyone's capacity to engage in it. So we paused that and brought a report back to this board in November, just reiterating that we'd pick it up again in early 2021, and that's what we're doing. That's what we're doing now. Obviously a lot's changed in that time, and I haven't tried to summarise all of that there, but obviously a number of issues were particularly highlighted during the pandemic. Really supported that work that we need to address the underlying factors, recognising we need to reduce inequality in the city, recognising the importance of a strong, resilient economy in enabling people to have successful outcomes, but also the ability of partners and communities and individuals locally to work together, and people's willingness to do more to help one another. There was also a piece of work to agree a new vision for the city. Again, not a city council piece, this is across the city as a whole, to agree a long-term vision for up to 2040. And again, what we've tried to do is reflect the language and prioritisation within our health and wellbeing strategy, so that we can make sure we're kind of in sync with that. We sent something out to the members of this board in May, just reiterating this process and asking for reflections on whether partners still felt that these are the right priorities, what has changed in the last year that we need to make sure we reflect, and what are partners' levers to address some of those underpinning causes of the causes. And we built that feedback into the presentation that we're going to run through with you today. As I said, the intention is through this meeting for you to confirm the broad focus of the strategy and the priorities that we want to include within that. And then we'll have detailed workshops looking at each of those individually to work out what success is going to look like, how we're going to work together to do that, what else we need to do as a system, and crucially, I think what we're engaging with our communities to understand what they want us to do differently, but also what they can do differently to help address some of these things. So there's a timeline on the bottom right there, which suggests we'll do those workshops over the summer, present a draft strategy in more detail at the September meeting of this board, and agree the final strategy by the end of the year. So what we've tried to do is capture the work that we've done previously and the changes that I've highlighted there into a single page, really, just because I think it's helpful to have something that we can refer to. Again, this is just a draft of what it could look like, not a final strategy. And we've made a few changes that I've just highlighted on the next page. So we changed the time frame, pushed it out further to 2030, reflecting the need to be long term in our thinking, and building on the discussions at the Place Partnership meeting that Joe York referred to earlier, which I think really did support this approach. And then in this slide, we've included the language from the Imagine Portsmouth vision in terms of our overall vision and our commitment around key areas. And and then we've kind of broken it down to three sections, really. The causes of the causes, the things that we need to do something different as a system to address, highlighting some of the work that delivery partners are working on in an integrated way, reflecting the fact that we're not starting this from scratch, as people have already said in this meeting. There's a long history of partnership work in the city that we're building on and need to make sure we're in line with. And then on the right hand side, what we colloquially refer to as the Wiggan Deal piece. This is a piece, an understanding of the need to engage with our communities, co-produce the strategy with them, and have meaningful areas where we want people to behave differently and do things differently, along with the system changes that we're looking to make. So that's what kind of underpins this single page version. And then bear with, this might need a little bit of explanation. All the time that we've been working on this together, we keep referring to a Toblerone model, and so we try to kind of represent that visually, because we find it really helpful in understanding what we're talking about. This is the first time we've tested it with a wider audience, so happy to kind of get feedback on whether this is useful or not. But what we're really saying is that as a health and wellbeing strategy, what we want to focus on is the base of the Toblerone. If we can grow that base of the Toblerone, there will always be pyramids of need. There's kind of the triangles of service delivery that get more and more acute towards the kind of tops of those triangles, and those pieces of work are going to continue. But it's not the board's role to be pulling. To kind of pull all of those into a strategy. What we're trying to do is grow the base, if you like, improve the outcomes across the city, so that we reduce the size of those triangles of the Toblerone across a whole range of different areas. So it's an attempt to kind of represent visually what we're talking about in terms of the causes of the causes, and we see that as being that base of the Toblerone. It's an illustrative diagram. It's not meant to capture all of the things that you could include on there. But we found it useful in our work, so we wanted to include it within this. So that's what we're kind of thinking in terms of developing the strategy. We sent round a draft analysis of some of the things that have changed over the last year, a steep analysis, and built in the feedback that we received from partners on that. And I've tried to summarise some of those key points in the box on the left hand side there. So obviously, the last year has seen significant changes. Obviously, sadly, a number of people in Portsmouth have died, and a significant number of people have been infected with COVID-19. We've seen significant increases in unemployment, increased need for services, eligibility for free school meals has gone up. But we've also seen, as I said earlier, communities coming together, both in terms of suppressing the virus, supporting one another, volunteering time, and also engaging more with their local environments. There's been a lot of social change, and I've listed just some of those things within there, and flagged up that there is optimism about the future. Trust in the NHS, trust in local authorities remains incredibly high. Lots of volunteering activity, and we've got an opportunity to build on some of those things while recognising the challenges. As we look to develop this new strategy together. As I've highlighted on the right hand side, though, the COVID-19 has really highlighted the what you as a board are well aware of, but the disproportionate way in which outcomes across a range of things, including COVID-19, are affected by the circumstances in which people live. And those who already face disadvantage and discrimination have been more adversely affected over the last year, and we need to reflect that in our strategy, and also reflect the kind of growing challenges around climate change and its impact on health, and the fact that the climate crisis is a health crisis, and we need to promote sustainable and resilient ways of living and being through this strategy if we're going to be serious about tackling long-term issues in relation to health and well-being. So that's a bit of background. What we've done since we last looked at this as a board is tried to integrate a thing called the Health Index that's been developed by the Office for National Statistics. So it was proposed by the Chief Medical Officer at the time, and launched in December 2020 for consultation, with a final version due out later this year. It aims to provide, as it says there, a single headline indicator of health that is transparent in its construction, can be compared over time at different geographic levels, and can be broken down into the effects that drive changes. That feels like a really useful tool given our desire to focus on the causes of the causes. It's built on a kind of a broad definition of health, as it states there. And we think it provides a tool both to help identify what our priorities should be, but also to measure progress over time. So if we're trying to address those causes of the causes that won't have necessarily a direct link with measurable outcomes, this will help us to see how those outcomes are improving over time across those three domains: healthy people, healthy lives, and healthy places. I'm not going to go through in detail how the index is constructed, but there's links in the slide so you can follow that through, and there's a detailed statistically sound methodology for doing that, and we think it's going to achieve wide buy-in across the country and more general use. I think it'd be useful for us to use locally. I've highlighted on there just where Portsmouth currently scores. So the 114 is our ranking out of upper tier local authorities. So Wokingham is the healthiest place on the ranking. Portsmouth is the 114th most healthy place out of 149 upper tier local authorities, with Blackpool the least healthy. So there are significant challenges within that. And on the kind of index that has been developed to visualize this, green areas are good, red areas are bad, and obviously so darker orange is not good. But you might just be interested to see where that puts us in relation to other places over time as well. So we're not an outlier in terms of our kind of position on deprivation. So this chart plots all local authorities on an index against the health index up the left-hand side and the indices of multiple deprivation on the right-hand side, and we're that orange circle in the middle. So we're kind of firmly in the middle of that line. Our position on the health index is broadly in line with what you'd expect in terms of our overall deprivation. Looking over time, Portsmouth's the bottom line here, and going up over 100 means you've improved on the position that England was in at its baseline in 2015. We've worsened from our position in 2015 in terms of our score on the health index, and we've worsened in our position relative to England as well. So there's some challenges there, and obviously this is up to 2018, so pre-pandemic. You can compare us regionally as well, which I've done on this chart here, and unsurprisingly, I guess, as a relatively more deprived area within the southeast region, we score a lot more reds and dark oranges than we do greens compared to the region. But I think probably there's other comparators that are more valid for this purpose. And what I've then done is tried to look at how we compare nationally against what are those areas, as I said earlier, looking back to those kind of outlying areas, where are we scoring particularly badly on the things that are underpinning our overall health in the city. And it really does support the priorities that your board previously identified around air quality, education, mental health and wellbeing. And I've just pulled out a few examples on there where you can see both our score, which is relative to a baseline position of 100, with anything below 90 representing one standard deviation away from the baseline position, which means effectively that the majority of local authorities should be within one standard deviation either way. So around 2/3 of authorities will be within that, between 90 and 110. So if we're below 90, it's quite concerning. And then there's a ranking as well. So we're 135th out of 149 authorities for air quality, 133rd for GCSE attainment, 139th for self-harm, and 113th for children's social, emotional, and mental health. And I could have picked out a number of other indicators. Those are just illustrative ones. But I think it really does highlight the scale of the challenge that we face in a number of areas and why we need to focus on addressing those long-term causes. And what I think we'll be able to do through looking at how our scores change on this index over the next 5 years, it's a long-term piece, is are we making a measurable difference on some of these things by addressing the priorities you identify in this strategy? And is that having an effect on the overall health of the local population, both over time and in comparison to other areas? So hopefully it will be a useful tool, and I think it does provide some strong evidential reasons for the choices of priorities that you've already indicated you want to consider. I'm going to take a breath there and hand over to my colleague Kelly, who's going to take you through the next few slides.
Lovely, thank you, Matt. So just to pull the work that Matt's outlined together, we're probably now in a position where it feels like there's broad agreement the strategy needs to focus on a small but high impact number of key drivers of poor outcomes, which we're calling the causes of the causes. The consultation and data analysis work that's taken place has also kind of given us comfort around the early thinking of the board. The three of the key areas that were identified: so education, air quality and sustainable travel and positive relationships and safe communities. All of those are relevant to the areas that we should be taking forward, and there'll be a little bit more on each of those to come in a moment. But we also identified two issues that feel like they're significant and bear a bit more consideration for inclusion, and these are poverty and housing. So just specifically looking at the issues around poverty, the city's had a tackling poverty strategy supported by a steering group for some time, and the focus of this work has been on mitigating the impacts of poverty. So it's notable that some of the measures have been needed by wider layers of society in recent years, and I think we've all picked up on things around, people needing to use food banks or needing money and debt advice. So it potentially feels like this is a broader issue. And again, if we need to think about addressing causes, an example given is around the role of the board potentially in looking at, for example, economic development or the living wage. So I think when we come to the wider discussion, how we treat poverty as we go forward in this strategy probably bears a bit of consideration. And obviously, there are reasons why we weight health data by deprivation. There's an intrinsic link, and it seems like it would be an oversight not to reflect that very strongly in the work of this board. The other area we're looking at is housing, and I think the link between a safe, secure place to live and people's health and well-being is well established. We're really fortunate in Portsmouth. There's some great proactive work to address housing needs issues, and this board has received previous reports of this through oversight of the homelessness strategy as one example. However, there do remain issues around homelessness, overcrowding, housing insecurity, fuel poverty, general affordability, and these are clearly underpinning issues for health and well-being, and it may be that there's a role for the Health and Wellbeing Board in supporting and enabling improvement around those. So again, that's another issue that may bear some reflection along some of the issues that we come to consider as we move through the strategy. So not necessarily inviting commentary on that now, but I think as we hear the other issues that we've identified, it might be helpful just to come back at the discussion in the end and reflect on how we'd like to see those considered. So I'm going to pause there, and I think Hayden's going to take us through the first couple of themes that we've worked up in more detail based on the previous work that have been identified.
Yeah, so the first theme, so when we met back in the early part of 2020, there was a pretty strong consensus that positive relationships is something that we can kind of work together on in terms of the evidence suggesting that isolated people and people with poor relationships with either within the family or within the community are often at risk of much kind of poorer outcomes. And there is evidence that the level of social connectedness is linked to happier, healthy lives. And this is doing quite a lot of heavy lifting, this positive relationships piece of work, because it does cover issues from mental health through to domestic abuse, through to social isolation, both of young people and indeed older people. And it also brings in some of our thinking around the experience of residents in terms of trauma, because we also know that the capacity for people to build positive relationships and social connectedness, have they experienced trauma, is compromised through a concept that's known as blocked trust. It's far more challenging for those that have experienced trauma either early in life or during adulthood to build connections with their family, their friends and the wider community, and can lead to a range of poor outcomes. The next box along the middle, we've kind of phrased it around the kind of targeting bit, the hyper targeting bit. So this goes back to the Toblerone model. So recognizing that any strategy which addresses the causes of the causes will also have to make reference to and point in the direction of work to meet the needs of our residents that are most vulnerable. So if we think about it in terms of relationships, certainly one of those that we will be listening in on a conversation later, which is around those 400 adults, estimated 400 adults that are experiencing multiple disadvantage through the Changing Futures programme. Another group that we will continue to kind of keep a very strong eye on is our care leavers, because we know that our 300 or so care leavers, there is an over-representation of social isolation and difficulties in maintaining friendships and relationships as children leave care, and around about 100 young people in the city who are criminally exploited and involved in or close to serious violence and repeat offending. Domestic abuse, one of them that we want to explore a little bit more. There is quite a lot of work in the city, but to reference high intensity users of acute services, and of course the issues around isolation of older people. So that's the kind of recognition that at the top of that triangle of need will be particular parts of the community that we have to have clear responses to. And then in the third box, you got some of the work that we could do through this strategy in terms of engaging citizens and communities. One of those particular favourite of mine is around restorative practice and some of the work we're doing in the children's arena, and particularly with schools around relational work and building trust and relationship and social capital for children in the school community and indeed with children's services. So that's the positive relationships side. So it's doing quite a lot of work around some of the things that are really important to us in the city that we know underpin poor outcomes, everything from social isolation through to domestic abuse through to poor mental health. Next slide, please. He said, sounded like Chris Whitty. So the next one is the next priority that we settled on at the early 2020 was around education. So particularly thinking about education of children, but also lifelong learning. So the reason this was chosen by the board is that there is a sense that some of the education challenges that we see in the city can underpin lifelong poor outcomes for residents. We do have, and we've got a lot of work taking place within the city to address quite unacceptably poor education outcomes from Portsmouth schools. We do bump along the bottom of this, and I think we presented some of the data on that to you a couple of years ago. We have quite a lot of work taking place around developing, for example, early language development, because all the evidence shows that the early development of language with preschoolers does have kind of long burn impacts in terms of improving outcomes for children, educational outcomes. We've just launched another piece of work to reduce school absence and school exclusions to support our schools to be more inclusive of children. We do have very high health-related absence in the city pre-COVID, not just during the pandemic. We also have this kind of interesting thing that we call the Portsmouth Paradox, because our Ofsted chums will tell us that our schools are increasingly good, and yet our outcomes are not, they're still static and still got some way to go. So actually we have an increasing number of good and outstanding schools, and an increasing number of children attending good and outstanding schools, but our Key Stage 2 and Key Stage 4 results remain with some distance to travel. In terms of the targeting bit, so particularly focusing on under fives with developmental delay. Obviously, some children have got developmental delay through kind of intrinsic disability, but many of our children have got kind of delays in their, particularly, as I said earlier, their language development. And if we can crack that at that point when children are particularly malleable, under fives, then actually we've got a fighting chance of improving lifelong learning outcomes. Attendance and children attending school below 90%. We have a particular focus at the moment on what we call chronic absence, so children attending school below 50%. Currently around 410 children in the city that are attending at that low rate that we are working with schools to address. Young people at risk of being NEET, which is actually going to be a growing issue post-pandemic. And again, there is strong evidence that shows that if youngsters experience a period out of education, training and employment, then their longer term outcomes are generally poorer. And then children with SEND, special educational needs and disabilities, particularly those for what's called SEN support. We've also done quite a bit of work, and we will be doing work through the Portsmouth Education Partnership to work alongside early years settings and schools in a high challenge, high support relationship. And also we're doing some work to develop school to school peer review and peer support to drive improvements within our 61 schools in the city. And then lastly, citizens and communities. So a real passion in our local parent forum really keen to kind of work with the Children's Trust partners on this. So particularly driving messages through to the community around the impact of reading with children. There's evidence that shows if you read 15 minutes a day with your children, their educational outcomes will improve dramatically. And talking with children, getting off your mobile phone and having a conversation with children, really, really important for child development in terms of parents, carers and family members talking constantly with children. The more you talk, the more they learn. And then just addressing that kind of citywide issue that we've had for a long time now, way over a decade, in terms of school attendance, where again we've been bumping along the bottom of the National League tables around school attendance. So that gives you a sense of what it is that we're working to do around education attainment, because we believe that that is one of the causes of wider poor outcomes for the residents of Portsmouth. I'll hand to Kelly.
Thank you. So I'll try to whiz through now because I'm conscious of the time, but in this particular theme, we're looking at two key issues, and they're linked to sort of the prism of mobility and accessibility of the city and broadly around the transport offer. And these two issues are air quality and physical activity. And we know that there are critical impacts of these issues, both on physical health through respiratory disease in particular, but also obesity. And these are two sort of really major factors of the city that we need to be tackling. There'll be more about this issue later in the agenda, so I'm not going to dwell on it today. But again, we've suggested a very similar model to the one that's been taken for the previous themes around that hyper-targeted work, particular groups, and then the sort of more systemic work across the wider citizens and city. So in this particular area, we're looking at the hyper-targeting around areas particularly affected by some of these issues and picking up on the previous work that was done around the super zone, for example, but then moving into the wider stuff with citizens, actually looking about how we develop that package of cost-effective, widely available solutions, but actually look to people to start making commitments around how they'll change and work with those. So, for example, committing to make sure the shorter journeys taken by sort of a method that isn't jumping in the car, for example. So that's where we're trying to get that balance. And as I say, there'll be a wider discussion around air quality governance later in the meeting. Very much starters for 10 on all of those things. And as we say, they'll be subject to consultation with stakeholders throughout the coming months. So just to wrap this up, it'd be really helpful if, having heard all of that information, we're really conscious there's a lot of information that we've thrown at people very quickly. But it'd be really helpful if the board could now just return to the recommendations in the paper and provide a bit of a steer on those priorities, and then also provide a mandate for us to work with partners and stakeholders to develop the detail of these over the coming months through a series of workshops with a view to coming back with a worked up draft consultation in September, which we'll then take out and bring back to you in a finalised version in the winter. So I think that's all that we wanted to say this morning. So thank you very much for bearing with us. And Chair, back to yourself, I think, for wider questions and discussion.
Lovely, thank you. Chancellor Smith. Oh, you're on mute.
Thank you. My concern with this strategy is that, and it's a very good strategy, it covers quite a lot, but it doesn't seem to link into any budgets from either the local council or health. And with all these strategies, it is going to need some commitment financially. And how do we link that with the priorities of, say, the City Council, who it doesn't seem that this strategy actually links to any of their priorities. And an example of that is the clean air zone, because that's been tailored to a financial issue rather than a health issue. So how do we bridge that gap? Because there's always going to be a gap if we don't.
Any comment back, Kelly?
Yeah, I'm happy to respond to that. I mean, I think that's something we've been really mindful in the development. But I suppose if we go back to the health and wellbeing strategy and the role of it as a statutory document, it is an influencing document. So what we need to do in the first instance is kind of pull together, from a health and wellbeing board perspective, these are the things we absolutely want to see, and we want to be driving through those individual organisations. I think when that's in place, we're in a position to be able to take that back through the organisations and say, well, how does this match with what's happening? How is it in line with those aspirations we set out in the health and wellbeing strategy, and what do we need to adjust around that. I think also it's probably worth saying that, and very much bearing in mind this was the start of 10 with those early stakeholder discussions still to come, that a number of the actions in there are kind of linked to those budgets, and it may be helpful that we reflect those budget lines within the strategy when we produce it in its final form to show where the sort of financial homes for those are, because a number of these schemes are, as we discussed already, in flight, and all of them will undoubtedly be sort of saying, well, we could do more if we had more. And I think quantifying where that scope of ask would be as part of that work around identifying the targeted work in particular would be something really helpful. So I think that's really, really helpful challenge back, and something that as we work it up into the detailed form, because I said this is very much our early ideas ready to move into that sort of fully forming, that's absolutely something we'll need to take into account. Thank you.
Sorry, Chair, can I just sort of come,
of course, come back.
Because, from my point of view, this should be influencing the politicians and health, not sort of getting the strategy going and then saying, well, this is what we want to do, so what do you think? I think it should be the other way round. So it's what influenced this important strategy, and it's probably one of the most important strategies we'll ever do going forward, how that influences local government and health, and I'd like a lot more drive from this board to those two authorities saying this is important and this is what you need to centre your priorities around, not the other way round, if that makes sense.
Yeah, thank you. Alison, did you want to come in?
Yes, just a few thoughts, and just to start with saying I do agree with Councillor Smith's general perspective on this, that this is a really, really important strategy for the city, and you've got all the partners around the table, so the engagement needs to be serious and influential. I think it's a really thoughtful piece of work. I think it's really good. I really support very strongly the emphasis on the importance of relationships, and you see that more and more now in contemporary thinking about the welfare state. I would give a plug for the Radical Help, Hilary Cotter's work on that, which absolutely emphasises these things. I would want to reassure the board that in terms of influencing priority for the council around education, the council completely accepts the need for a strong education strategy. The education partnership that Hayden referred to is something we've built up over the last 4 years, and is a strong and healthy partnership. When Hayden says the majority of children attend a good and outstanding school, and we're talking about over 90% of our schools being good and outstanding, it is a real paradox. Ofsted are rating them well, but they are struggling nevertheless to get to where the children need to be on GCSEs, and the children's life chances are not helped by they've come from a good and outstanding school. They actually need those qualifications. So I think our schools recognise that and are really determined to work with us in the ways that Hayden has described. The last point I'd make is about the question of whether poverty should be recognised more strongly, which I think was a question asked in the earlier slides, and I would say that yes, it does. I do think that the economic strategy for the city is hugely important for its health and well-being. We need families with incomes that will actually support them. And we have not only families struggling to feed children, which we know about, but also families not able to be with their children and support their education because both parents are having to do 2 jobs, and there are just not enough hours in the day because they're not paid a sufficient living wage to manage without putting the hours in, which takes from their children. So the economic conditions of the city have a direct impact, and I do think poverty needs to be right up there in this strategy.
Thank you. Claire was next, and then Jackie.
Hi, thank you. I'm sorry, but I've lost some of the features of this Teams call, having lost connection and rejoin, so I didn't see all of the presentation. I had to imagine it. And I'm quite used to Matt's excellent presentation, so you did bring it to life, thank you. But the first thing I would acknowledge is really good to see that causes of the causes being discussed and the public health approach to all of this, which is very much in line with our policing approach and where we want to get to. But I just wonder, and this could be my naivety, around the links between this strategy and the community safety strategy. And I can see some really clear elements where there is linkage, maybe around domestic abuse, and then going back to Alison's point, looking at the poverty and housing, to me those links with child neglect and our concerns that we might have around that growing area within the city. And it's just how we reference the two and make sure that they are linked, and I guess serious violence would be my final point as well, that is clearly articulated within the strategic assessment. And does that feed into this health and wellbeing strategy?
Okay, thank you. Jackie.
Thank you. I think I'd echo everything that's been said actually about the importance of linking up what we've previously got in place and how we use this strategy to drive through the changes that we'd like to see. And I think tackling poverty and the impacts of inequality is right up there in my eyes. And also that things like educational attainment in the sort of work that I do is a big driver, but without healthy mental health, then that tends to fall away. So it's hard to separate out educational attainment from having good mental health. And if the two aren't interwoven or the strategies crossing over, then we might well have schools that have a high academic in terms of Ofsted, but may struggle to get pupils to attain their GCSEs, because a lot of the time, from what I see, is because they're struggling also with their mental health, especially as we come out of COVID. So it's tying all these pieces together so it's coherent, I think.
Yeah.
That makes sense.
Yeah, no, thank you, Jackie. I've got a few hands now. So I've got Councillor Vazacali.
Yes, thank you. This is my first meeting, so obviously I haven't got the experience a lot of you have got in regards to your participation with it. It's just basically to come back on what Councillor Smith said and try and give a reassurance from a political perspective. I mean, there are six councillors actually present at this meeting at the moment, three cabinet members and 3 opposition spokespersons. But I think certainly from my point as being new to as the new portfolio holder, I don't intend this just to be a sort of empty words exercise. The strategy itself is, in my opinion, extremely encouraging, and there are so many. I'm surprised to see so many people that are actually present at the meeting representing various organisations, but obviously all with a clear aim of working towards making improvements for Portsmouth. So not a great deal to add here, but just simply to say that in regards to financial commitments, obviously local authorities aren't awash with cash, but there are funds available, and I will be doing what I can in line with officers within that portfolio to try and make sure that the local authority plays its part. So thanks for everyone today. It's good to see so much participation. I'll try and come back on future issues, but that's really to try and reassure the 3 opposition spokespersons, plus obviously other members present, that from a local authority perspective, we'll do our bit. Thank you.
Thank you very much. Jo.
Thank you. I guess similar to Councillor Vazacali, just want to reassure on Councillor Smith and echo what Alison Jeffries has said, really, from the NHS point of view and the CCG point of view. This is absolutely a priority, and we totally understand the need to work on the wider determinants of health if we're to tackle health inequalities. And we've seen from the pandemic how damaging they can be, right here in the city. So again, I think that reassurance that this is a huge priority strategy for us, and we need to look at how we support that and resource it moving forward. I think it also plays back into the conversation and the update around future arrangements that we talked about earlier, those place-based arrangements, and having that local delegation of the NHS budgets, which will be held by the ICS in the future, delegating those down into the city so that we continue that integrated approach between health and the council will be really important. So getting that right and having the focus on that over the next few months will be really important to this strategy too, I think.
Lovely, thank you. Matt Gummerson, do you want to come back in?
Yeah, just really quickly, I think just to reassure Claire that yeah, she's absolutely right. We definitely need to make those links, and there are references in the slides to try and make sure that we have reflected the fact that this needs to link to the work around the strategic assessment priorities for community safety, the serious violence duty, the work of the violence reduction unit, etc. So yeah, we will absolutely need to clarify that, but it is definitely in our thinking. And just again, to completely agree with Jackie's point, I think the challenge when you try and present these things and start separating them out is that you look at them as separate priorities. But absolutely, what we're all, I think, trying to recognise is that these causes underpin poor outcomes across a range of things, and you know they're not. There isn't a separate priority around mental health and a separate one around education attainment. They are two things that need addressing alongside one another. And indeed, even once you start looking at increasing physical activity and addressing obesity, that would also have an impact on improving mental health and well-being across our communities as well. So they are all connected.
Lovely, thank you. Hayden.
Yeah, I was going to make a similar point back to Claire. There is still the need. We've got a children's plan. There'll still be a community safety plan. There'll still be those important things. One of the bits that I think might help. It certainly helped my thinking when myself, Kelly, and Matt were working on this. Was the traditional model is that your health and wellbeing strategy sits above, and you've got what's called the bookcase model of strategies. You have a big overarching 75-year plan with lots of kind of promises, and then you have kind of more mini plans kind of underneath. We tended to flip that a little bit and think about this as an underpinning strategy. So in order to kind of really tackle the causes of the causes, which underpins a range of other work, whether it's in the children's arena, the older people's arena, the domestic abuse arena, the community safety arena. So I've personally found that a little bit helpful, just to kind of flip it a little bit and think about how it is that we kind of underpin the more detailed work we do with particular parts of the population.
Thank you. Lovely. Andy and then John, and then we'll wrap up this item.
Thanks, Linda. I won't rehearse everything everyone else has said because I think it's all valid and I'd agree with it all. I think just a personal view that if we don't include two of those giants, the tackling poverty and the housing, then we could hamstring ourselves. I think just thinking a lot lately about, people that don't have a roof over their heads or don't have somewhere they call home. Where do you start if you haven't got that, if you don't know where you're sleeping, if you don't have some element of security? And also thinking about some of the impacts of poverty on the inequalities that we've seen in very recent times, and the increase in people, picking up some of the points that Alison made really about people working two jobs, being in receipt of in-work benefits and still having to use food banks. We've got a real problem, an underlying problem in our society with poverty. So I think for me, a plea that we do include tackling poverty and housing, they're really fundamental. And if we don't, we may not see the same positive impact on the causes.
Yeah, lovely. Thank you. John.
Thanks very much. And it's going to be slightly echoing other comments from me, but I just wanted to say from our perspective, from my perspective, from the acute hospital as one of the often common endpoints for some of the problems around health that manifest through this kind of thing, just how important this is. It does feel, doesn't it, like we're at potentially we have a pivotal moment coming out of COVID, and I really welcome this strategy. I really welcome the conversations that we had with Matt and Helen and others in terms of our involvement in it, and very keen that we play our part as much as we possibly can do, and probably more than we have previously done as the big, expensive, shiny NHS facility on the top of the hill, to use our influence wherever we can do to help with this, and really, really welcome it. Thank you.
Thank you very much. And Alison, sorry, you stuck in there.
Yeah, just a thought, because it was really helpful actually to hear the thinking from Hayden about the underpinning strategy as opposed to overarching, and I do think that's a good idea, and obviously hence the Toblerone. Sorry, I've got sirens going past me if they're distracting you, but I wonder whether we need to think a little bit about what is a triangle and what's an underpinning, and education's quite an interesting one from that point of view, because It absolutely is an underpinning, but it's also a triangle. And there's almost something about a diagram which shows like a sort of an arrow, a curving arrow from the top of the triangle right to the underneath of the Toblerone, that, you know, if you get all these triangles right, your underpinning will be better. So this is actually self-reinforcing. And we could get very tied up in this, and I'm not trying to prolong the meeting for a conceptual discussion here, but we need to think when this lands, particularly if schools are reading it, are they thinking, oh, so we've got to do everything, we've got to pull the heavy weight, have we, to get everyone's health up? And I think the poverty and the relationships are more natural thinking about underpinning perhaps than education, but education is so significant for the city and it needs to be there. So I'll just leave that with people to have a think about.
Lovely, thank you. Kelly, was that an old hand that's up, or was that a new comment?
No, that's an old one, sorry.
Lovely. So obviously lots for us to still to discuss with this topic. So we've been asked if we are in agreement with the priorities, and are we happy that some of these priorities then go off to be worked up through stakeholder workshop, where we can obviously have more conversations like this and really develop them further. Yeah. Now, Kelly, did you need agreement about the other two, or is that for the workshops?
No, I think we've certainly taken a steer from this conversation that we should look to develop the poverty and housing themes more strongly. So we'll do that, and we'll build them into the same model that we've brought forward for the others, and that'll be how we'll present them back. But you know, I think on behalf of the three of us, we'd say that's been an incredibly helpful discussion. So thank you, and we will take away our Toblerone and augment it with some fudge. Thank you.
And we will look forward to some workshops on that, because I think there's a lot of people interested in having the conversations, aren't there, which is fantastic.
Yeah, absolutely. Maybe just on that, if there are people who want to be particularly involved in any of those themes, if you just drop myself, Hayden, or Matt a line, and we'll just make sure that anyone gets represented on those, and we don't miss anyone by sort of accidental omission.
Lovely, thank you. And can we have those slides circulated, because they were quite small reading, so yeah, that would be great to have.
Absolutely. We'll send them over to Anna to get round with the formal papers.
Fantastic. So we're moving on to one of the key priorities, obviously air quality, and it's Dom doing this, isn't it?
Thank you. So this is an information item on the governance arrangements for the Air Quality Board, and obviously very relevant given what we've just been discussing in terms of the strategy. The paper outlines the proposed governance arrangements to oversee and coordinate the air quality obligations in terms of our legal obligations in the city, but also our kind of wider ambitions as was outlined in the strategy. So obviously we've talked before at this board about the substantial impact, negative impact on health and well-being of air pollution, and that's what the board addresses. It's going to be an executive. It's replacing the current Air Quality Board with a broader remit. It's establishing driving the air quality agenda, ensuring that that's integrated with the work of the council, but also with the partners across the city, to make sure that we are reporting on that for the Health and Wellbeing Board as part of the strategy, and to be chaired by the new board member for climate change and green recovery. And the first activity of that board is to undertake an understanding of activity already underway, where the gaps are, what the output is, and how we can continue to drive the agenda forward.
Lovely, thank you. Are there any questions or comments, or are we happy for what's been proposed? Councillor Mellor.
Thank you. Just a question around when is the board likely to be established, and also as well, I'm the councillor for Charles Dickens Ward, an area in the city that faces the highest levels of air pollution and health-related illnesses. This is just a comment, but I just want to state that I do think that Fratton and Kingston Road should have been included in the clean air zone, so that residents of Charles Dickens are able to breathe clean air. Thank you.
Thank you, Kirsty. Yes, clearly Charles Dickens, absolutely is an area of concern, and a lot of the work, not just in the Air Quality Board, but in other parts of the work that we're doing across the council on the super zone was mentioned earlier on, is clearly a focus for us. The CAS parameters have been set by JACU, by the Joint Air, now I'm struggling to remember the exact acronym, by central government, by DEFRA. And so that's something that locally we've got less influence over. We can be ambitious. That will meet our requirements for reducing nitrogen dioxide in the city. In terms of air quality, we can be more ambitious and continue to drive down air pollution in the city. And I think we absolutely need to maintain that focus, not just on Charles Dickens, but on the whole city. Air doesn't respect ward boundaries. So any improvements we can make in Charles Dickens will also have benefits for other residents in the city as well.
Thank you. Councillor Vernon Jackson.
Thanks very much. Just quick response to Kirsty. The advice from the officers looking at the air quality zone was that it would make no difference to the city hitting the right targets for air quality if those roads were in or not in, and therefore Fratton Road being an area of significant deprivation, and with trying to make sure that we support retail. We didn't want to drive shops out of business in areas of very significant deprivation, and therefore remove services from local people. But I think the important bit was that the advice was it would make no difference if it was in or not in the clean air zone to air quality. Thank you.
Thank you very much. Any other questions or comments before we move on? No? Lovely. Thank you then, Don. And you're feeding that back to the board on regular occasions, it said, didn't?
Yes.
We look forward to hearing that then. Thank you. Domestic abuse is the next topic.
Hi, Linda. It's Bruce Marr, Head Harm and Exploitation.
Hi, Bruce.
If I summarise the report quickly, and then obviously happy to take questions. So this report is coming to the board to update on the new duty on local authorities, statutory duty under the new Domestic Abuse Act, which received royal assent in April. There are 5 recommendations in the report. And in relation to the background, there's 7 parts to the Act. Part 4 is specifically placing a new duty on local authorities, Tier 1 authorities, to provide safe accommodation to victims of domestic abuse. In paragraph 3.1, there's bullet points of all the duties on us as a local authority. And to assist in meeting the duty, the MHCLG has awarded Portsmouth just under £550,000 for until March 2022. In the spirit of the new burdens, the MHCLG do advise that the new duty will be funded in future years. However, they're unable to provide any confirmation of what this will be from April 2022 onwards. In meeting the duty, the Domestic Abuse Strategic Group have agreed in principle to undertake the new statutory role of having a Domestic Abuse Local Partnership Board, and I've embedded the terms of reference for that, identifying who those parties need to be. We've employed a new domestic abuse analyst whose role will be to undertake the annual needs assessment and updating the 3-yearly strategy that's required in the bill. The MHCLG are currently consulting on the final legal requirements, and therefore we have no commencement date for any elements of Part 4 of the Act, and the consultation is due to end at the end of July. We are in the response of responding to that. And paragraph 4.3 identifies the recommended allocation of funding for this financial year. And this leaves in paragraph 4.3.5 an unallocated amount of £170,000, which we can allocate once our needs assessment this year is completed, which is why in the recommendations we're asking that for this year only, the Health and Wellbeing Board pass a delegation of the funding for the £170,000 to the Domestic Abuse Strategic Group. That's my report in a nutshell, and I'm happy to take questions.
Lovely, thank you. Any questions or comments? Oh, so we've got Councillor Mellor and Councillor Smith. Kirsty, do you want to go first? Oh, you're on mute.
Oh, sorry about that.
It's all right.
Is there any scope at all for survivors who are free from abuse to sit on the board? Because I think it's really essential that we always listen to the voice of survivors when tackling domestic abuse. Thank you.
There is a duty under the Act to ensure the voice of the victim is heard as part of the board. The agreement of the board is that our domestic abuse provider, Stop Domestic Abuse, will ensure the voice of the victims are heard. There is nothing stopping us identifying a service user to sit and to contribute to the board. One of the challenges we've had, and what Stop Domestic Abuse advise, is that on the whole, victims of domestic abuse, once the matter has been dealt with, they want to move on with their life. It's not like in the substance misuse world where some ex-users will want to come back into the as part of their recovery will provide support to others. But if we are able to identify a victim, and I can speak to Stop Domestic Abuse about that, then there's no reason why they can't be involved.
Okay, thank you. Councillor Smith?
Two questions from me, if I may. One is the initial funding ring-fenced for this, for domestic abuse? And if not, is there a danger that it'll be picked off for other things? And the second, can I make a recommendation for the board that the newly appointed champion for domestic abuse actually sits on the board? And that will be decided at the next cabinet, I believe. So that would be a good person to sit on the board as well, to have some sort of political influence on it as well.
In response to the funding, it's not ring-fenced, but the MHCLG clearly say that we have to provide evidence how we've met the duty. With regards to the champion, I'm happy to take directions from the board. Currently, the lead member for domestic abuse, the lead member I report to on domestic abuse is Councillor Ashmore, as portfolio holder for community safety.
Okay, thank you. Councillor Vernon-Jackson.
Thanks, those very helpful contributions. It seems to me that there's almost nothing more important than trying to sort through and find solutions to domestic abuse. I remember research that we did in terms of troubled families work, that if the one thing that was consistent within those families was domestic abuse, and it seemed to be the golden thread that went through all of those families who were having a really, really difficult time, and where things were going wrong in education, in health, with criminal justice system, with a whole range of different things. So if we're able to address and have a real impact on domestic abuse, I think that's going to be enormously important. It would seem to me, I think Kirsty's suggestion of having a survivor, if we can find somebody who's a good person, who's a very good idea. I'm very happy to support that. Kirsty's been put forward to be the champion, and that seems very sensible to have her on, as well as Dave Ashmore, who's the decision maker as well. So if we can be working together on this, but it seems to me this is hugely important piece of work for not just the council, but all the agencies here, so that it can have a major impact in driving positive change in families across the city. So all very sensible and helpful things. I'm sure that the money that is coming here will be ring-fenced by the council, because it's such an important issue that we will want that money to go towards that. I think there's a really big problem, though, is that so much of the funding for this is short-term money, and Bruce and his team spend their life bidding for money, which when they actually should be out there doing the work. I'm not saying you're not doing the work, Bruce. But it's such a wasteful way of operating that so much of the time is spent in having to bid for short-term money. So I think I'm very supportive of this. I think having Kirsty's input as champion will be very helpful, as well as somebody who's been through this and survived as well. So I think this is very good, and I'm very supportive of this.
Thank you very much, Jackie.
Thank you. I completely echo what's just been said, actually, completely. I think that it's so important that, you know, whether or not there is reoccurring allocated funds for this, we need to be able to find a way to sustainably provide these services, rather than having to go out to tender every 2, 3, 4, 5 years and snatch little bits of it. If we really feel this is that important, we need to find a way, I think, to get it on a sustainable footing. And I think it's really important to get the voices of those people that have lived through or are living through domestic abuse and their children. And if there are other ways of actually accessing their voices, it doesn't necessarily mean they have to sit on a board, but for us to proactively reach out to get the voices of those people, I think that will be very, very valuable. And my last one was a very pragmatic question about how many beds do we have as refuges within the city or the neighbouring area. That's it.
Thank you, Jackie. Bruce, did you want to answer that if you can?
Within our commission contract, we have 16 units, so that's 16 beds for victims. Some of those units have more than one bed to accommodate children. As part of COVID funding, Stop Domestic Abuse and Housing worked and identified another 5 beds, which is outside our contract, but Stop Domestic Abuse will be self-funding those, and this funding is going towards contributing to that. So we have 21 units as a city. There's no statutory level of requirement on beds. I think it's the EU or UN Convention of Human Rights recommends 1 bed per 10,000 adult population.
Okay. Thank you. Claire.
Just a final point on this really from me, and in absolute support of the last 2 speakers and their views. Currently 50% of the investigations that sit in the investigation centre at the top of the Eastern Road are domestic abuse. That's how big the issue is in terms of what we're seeing through policing, and that is greater in our area than in the other 2 areas in the county. I can't explain that, but it is a fact, and I think the investment in that area is absolutely critical. And the short-term bidding, yes, I completely empathise with that as well, and I know there is a piece of work going on within the OPCC at the moment to tackle that, and that's all I'll say. And I'm afraid I need to leave to open another meeting, but it's been really interesting this morning. Thank you all.
Thank you, Claire. Thank you. I think we'll have to bring this this topic to an end. So I think this was the update. Was there anything specific we needed to agree, Bruce?
There are 5 recommendations to agree, so if you're agreeing to them, that's great.
Yes. Has anyone got any concerns about the recommendations that are being asked to agree? No. Lovely. Thank you then, Bruce.
Thank you.
Joe, Guildhall Walk.
Apologies, struggling with the mute buttons today. Yes, thank you, Lind. Thank you, Chair. We've been asked to bring this, CCG has been asked to bring this paper to the Health and Wellbeing Board by the Health Overview and Scrutiny Panel for an update. Unfortunately, due to timing apologies, due to timing and heard from one thing or another, we weren't able to bring it earlier in the process, but this is an update report as to where the CCG has got to with the re-provision of primary medical services for patients currently registered with the Guildhall Walk practice. I think just to give you give the board a bit of background, the Guildhall Walk practice has an unusual contract that the majority of GP contracts are not like this. So this contract went out to tender a number of years ago on what we call an APMS contract, an alternative medical provision contract, and alternative primary medical services contract. It's the only contract we've had like this in the city, and it was a fixed term contract. The contract was due to end at the end of September this year. We had already extended it, and so we're therefore in a position where we would need to go out to either end the contract or go out to the market to re-procure the contract. And we chose, a CCG Primary Care Commissioning Committee chose not to do that for a number of reasons. And the one of the biggest reasons was there was an uncertainty around the building, and the landlord, as you'll see from the report, the landlord has now given notice to the practice and has put in planning permission to utilise the building for something else. So we were in a position where we would have to go out to tender, and we had no real premises for to offer that as part of that tender. We also had a number of other issues whereby we knew we had capacity in other practices in the city, most particularly the university practice or the new Uni City practice, which has capacity and is due to move to a purpose-built building on Commercial Road in December, so later this year. So we felt on the basis of that we would potentially be saying, if we decided to re-procure, we would potentially be looking at a situation where the patients currently registered in the practice with Guildhall Walk would be moved location and moved alternative provider if we went out for a re-procurement tender exercise and another provider came in that wasn't the Practice Plus group who currently run it. PHL, sorry, the PHL Partnership Health Limited group who currently run the service. Apologies. So we didn't feel that was fair to patients, and so what we decided to do was a managed transfer into alternative practices existing already within the city. And so that gave patients an opportunity to choose which practice they were transferred to and enable that alternative provision to be managed for all patients. We're in the middle of that process and nearing the end of that process. Actually, we have run a number of engagement events with patients of the Guildhall Walk. Unfortunately, they were virtual because we weren't able to get in a room at that time, but we did those through different periods during the day, one in the morning, one at lunchtime and one in the evening. We use that information and the questions asked to develop some frequently asked questions, but also to provide more information. Patients were given just over were then written to asking based on their location, so their individual postcode, were given a choice of practices nearest to their location. And they had about 2 weeks to come back, and they could do that online or they could telephone us to enable us, give us their choice. There was also some text messaging for patients as well. Just over 1,000 patients responded expressing a preference, with 6,547 patients choosing not to complete the survey and to have the allocation done for them. So we have now been working through that process to allocate, ensuring that everybody that did make a choice is able to get their first choice, and then working through with other local practices around how that's done in a managed way, and that information is due to go out to patients shortly. And then so a particular concern, certainly when we've had conversations, how we manage ongoing care for those people who require it. So that could be end of life care, people requiring daily dressings, for example, and patients requiring who had perhaps complex prescriptions, and making sure there was no issues around those prescriptions. We have worked closely with the practice on that. We've also been quite fortunate in that we have an experienced practice manager who's managed one of the only other managed transfers or practice closures in the city. She has gone into PHL to work with them to make sure we have a really clear process for identifying those individual patients who we need to flag on the receiving practice system to make sure there are no disruptions on those ongoing care. And again, that's also the case for vulnerable patients, perhaps those with learning disabilities. We've also done a particular piece of work around homeless patients in the city. You may recall as a board that at a point in time when Guildhall Walk Practice first was commissioned, it had quite a large homeless community. Those services have moved on, and we have been developing in partnership with the City Council and Brunel Primary Care Network, which Guildhall was a part, a more effective outreach service to the homeless community, and have been doing that with the PCNs. We've been very proactive in targeting that community for their vaccinations and are continuing to develop that outreach service. So again, we've been working with the Guildhall Walk to identify the homeless patients still registered with them. Some of them may already be receiving services from the outreach service, and again, make sure that that transfer happens safely as well. So that's really where we're at. As I say, we were asked to provide an update to the Health and Wellbeing Board, and just to work with you to, as I say, it comes fairly at the end of the process, but we feel we have tried to cover as much as we can to ensure that those vulnerable patients are supported through this, and that we have been able to provide alternative medical cover to all patients currently registered with the Guildhall Walk through this transfer process. Thank you.
Thank you. Any comments or questions? Oh, Councillor Mellor.
Thank you. So I've got two questions. The first question is around the safe space support for vulnerable patients. What is the time frame for the review to be completed, and what are the viable options for an intern solution if required, please? And secondly, the special education service. I do have concerns about these particular patients, many of whom already face barriers to healthcare. And I'm worried that they're going to potentially slip through the cracks in services. Can the CCG guarantee that all special allocation service patients will have access to care and support, particularly those who are unable to access a digital service? Thank you.
Yes, so if I start with safe space, safe space is the sort of the alcohol service that has been running in the city. It's very much a partnership arrangement with the City Council, with the ambulance service, and the CCG and the nighttime economy to support on Friday and Saturday nights to reduce instances of people perhaps suffering from alcohol misuse who end up in QA. So it's a local service that has been well established for probably well over 10 years in the city, and its most recent home has been in the Guildhall Walk surgery. We obviously, because of COVID, the service had stopped anyway as a result of COVID. We've been working very closely with public health colleagues and local police, and looking at how we re-provide the safe space service. There's a huge commitment to re-provide that. We're looking at alternative venues. I think the venue that we had chosen was St Luke's Church. I think the ambulance service have concerns it might be slightly too far out. So we're back in discussions with the City Council to see if there are any alternatives again within the Guildhall Square, really. So any other parts of buildings in that area that we might be able to utilise, and those discussions are ongoing with City Council colleagues. So it's a separate service to the Guildhall Walk surgery. It was it was located there, and so we would have similar issues anyway around re-provision, given the landlords, the notice that's been given with the landlord. So again, I'm really hopeful that we'll be able to provide that, because there's a huge commitment from a lot of members around this table to re-provide that service and to find suitable accommodation. With regards to the special allocation service, again, that is another different contract, and that contract, so it's contracted differently. The current provider of that is PHL. That service is contracted, or we commission that service alongside other CCGs in Hampshire and the Isle of Wight. See, they recently merged from April, so it's easier. It's just us and one other CCG, but the intention is to continue to work with PHL to provide that service for all patients requiring it across Hampshire and the Isle of Wight. We're looking at options with them. Through the pandemic, they have supported more and more people digitally or over the phone, with less patients requiring face-to-face contact. However, we still recognise the need to do that face-to-face contact, so we're continuing to explore with them. At the moment, it's the only base is in the city, and that covers the whole of Hampshire and the Isle of Wight. So we are talking really small numbers of services, but we're continuing to make sure that we can provide that face-to-face provision, and working, if we can do that in partnership with local practices as well as PHL. So that provision will continue.
Lovely, thank you. Roger.
Hi, Joe. I'm reading your update, and it says transfer of patients to the new practice is to be undertaken by the end of August. And you talked about a letter. I'm just wondering, there's also mitigations being put in place. I'm just wondering where we're at sort of patient-wise for that. Are there sort of numbers, or you're looking at, kind of by the end of this month, or, where are we at?
Yeah, so I think we're at the point where those letters are in transit, probably. That's why I didn't want to say we've written out to the patients, because probably they haven't received them. But that was certainly our aim, was to get those letters out by the end of, I think it was the end of last week. We may have been slightly delayed on that, just as we've finalised making sure we get the numbers right and get the capacity right across the other practices. As I say, there are a number of other practices with capacity, so we have no concerns about that. But it's also making sure that we also make sure we don't destabilise the primary care network within the city, so that we're keeping those patients within the primary care network where we can, making sure that we've got the choice, those patients that have expressed a preference get their preference, and then working with individual practices just to make sure that they can manage that. And the other issue was around when the IT provider would make the transfer. So we were trying to have that letter that's due out be a final letter that would be very clear to patients: this is your new practice, and this is the date when you can start accessing support from them. In advance of that, please continue with the Guildhall Walk. That was slightly complicated by the IT provider when they would make those transfers, so that's what's delayed us. But yeah, those letters are either on their way out or will be going out imminently.
Okay, thank you. So if there's no other questions, we'll move on from that topic. Any other comments or questions? Lovely, thank you. Children's physical health strategy next, please. It's Anthony Harper, isn't it, presenting?
It is. Good morning, colleagues. My name's Anthony Harper. I'm the Head of Integrated Children's Commissioning for Portsmouth City Council on the CCG. I shan't go through the whole strategy with you. I believe it went out with the minutes beforehand. I just wanted to present the strategy to colleagues to present the long-term ambitions that we have within the strategy and to seek commitment really from organisations across the city to taking the strategy forward. We have had a strategy within Portsmouth for children and young people's physical health for a number of years. The strategy has seen a great deal of good work over those years. However, we continue to see a number of objectives remaining as an issue for children and young people, many of which were raised by Hayden and colleagues earlier in the main health and wellbeing strategy presentation, particularly thinking around children's weight at the end of year 6 and year R, thinking about our conception rates for young people under 16, the weight of and smoking by pregnant women all continue to be significant issues for us. Over the last several months, the steering group have been pulling this strategy together and have decided if we want to make a lasting, meaningful impact on children's outcomes, we need to be brave and ambitious as a system about what we want to do. We want to move away from short-term activity and to look much more at our long-term ambitions and how we can fundamentally change the way in which children and young people kind of experience living within Portsmouth. The strategy underpins the belief that the use of behavioural insights is important to securing our success, and the ambition is to create a culture where using behavioural insights as everyday practice, allowing those healthy behaviours really to thrive across our population. What the strategy does is outlines 8 short-term activities that we will be able to build on existing good practice. We know that these activities work and are having an impact. These are around perinatal mental health, reduction of smoking, healthy weight for pregnant women, initiation of breastfeeding, the use or greater use of long-acting reversible contraception, increasing activity levels of children and young people, and reducing the number of young people experimenting with and using substances long-term. The strategy outlines 4 long-term strategic ambitions. The first one being the best start, which is around ensuring women and partners are making informed decisions about becoming pregnant, and that all women have access to opportunities which improves their physical and mental health. The second one is around thriving parents, which is really looking to support parents to fulfil their key role and to make sure that we are providing everything that we can as a system to allow that to happen. The third one is around reducing the impact of poverty, something which the board has discussed at length earlier, and the importance of reducing health inequalities. And the third one is around healthy places and built environments, and an ambition for this strategy to really influence key decisions across the board around the built environment and the way in which we shape the place that children and young people are living in. The strategy is really seeking to be something which links across a whole range of other strategies. It's a core strategy within the Children's Trust Plan, but we are also envisaging linking and influencing a large number of other strategies and plans across the city. Obviously, my graphic isn't as fancy as the Toblerone graphic, but the hope is very much the same as that vision. Really, is to use this as a platform from which to build a number of other key things from. Our overarching aim for this strategy over the coming years is to fundamentally shift the way in which we think and support families, wanting to make sure that it becomes everybody's business and that we truly look to change the way in which we function and operate, moving away from short-term activities that have an impact in a moment in time and moving much more to long-term cultural change that will have an impact for children and young people going through their lives. I'm happy to take any questions or any thoughts that colleagues may have.
Thank you. Any comments or questions? No, we've got silence. So this report was to inform the board of the work to develop the new children's public health strategy, to outline the agreed short-term activities and long-term objectives, and to seek our views and opinions from the board prior to its public launch, and to seek commitment from the board members. Oh, we've only got two people. Should we start with Alison and then we'll go to Jackie?
Thanks, Chair. I really just wanted to say a big thank you to Anthony and for colleagues for pulling this together, because it's a really important part of our Children's Trust Plan and the strategic landscape, and obviously a really important triangle in the Toblerone or an underpinning, whatever. But it's extremely important either way. So thank you very much, Anthony.
Thank you, Jackie.
And mine was probably a big thank you to Alison as well. And that, what do we do when Alison disappears really from her role? And a big thing about, I know it will be there, I hope it will be there, is that co-production that includes young people themselves. That feels important too. Thank you.
Thank you. Alison's just come back up.
I just wanted to underline how very little I had to do with this. I have a fantastic service and strength and depth in it. Anthony and colleagues can manage fine. Everybody will be absolutely great. Obviously, I wish Portsmouth did very, very well, but you are in good hands.
Thank you.
Just to come back on the co-production question, I guess, just to reassure that parents were absolutely involved in this steering group and will be a key part of the strategy board that Helen Atkinson will pick up chairing next week for us. The parents will also be taking forward the Portsmouth Deal for Parents, which Hayden mentioned earlier. So that's something that will be co-produced and will live within this strategy in terms of monitoring and underpinning. In terms of our co-production with children and people themselves, there's a whole range of work in various activities and strategy pieces, particularly thinking around our social, emotional, mental health work. There are a number of pieces of work in there. So yeah, co-production is absolutely core to moving things forward.
Thank you. Any further comments or questions? Lovely, thank you. So moving on to our last paper, and I'm really sorry because I'm very conscious of time now. Lisa Willis and Dave Adams for Changing Futures.
Right, Dr. Colley, can you hear me?
Yes, I can, thank you.
Presenting this, I think. Fantastic. Mindful of time, so I'll be brief. This is an update for information to the board. In December last year, the government launched Changing Futures, which is a programme that's aimed at improving the way that services support people experiencing multiple disadvantage, by which we mean homelessness, substance misuse, mental health problems, domestic violence, contact with the criminal justice system. I think you've seen from other reports today how often those issues are interlinked and reinforce one another. Now, as the report notes, we did bid for funding from central government to participate in the programme, and we were unsuccessful. Now, while that funding would have been useful, we would have been constrained by central government timescales and reporting processes. And it was felt that the work was important and certainly had the opportunity to have a big impact in Portsmouth. And so in April, a report was taken to the Health and Care Exec with a proposal to proceed anyway and to carry out a systems thinking review in this area over the next 2 to 3 years. Now, if we do proceed, this work would look at the local system in real granular detail and provide you with an understanding of how individuals engage with different combinations of services over time. So is someone, for example, who's experiencing homelessness also receiving support for their substance misuse problem? Are they having difficulties accessing support from other parts of the council or mental health services and so on? The underlying logic of it is that there's a mismatch between the complex needs that individuals have and the functional design of services. If you think of the way we organise our services, it's broadly around, and quite often, anecdotally at least, we hear of individuals bouncing between services where they're not eligible, or the care that they need from multiple services not being well aligned. So a key part of our task initially is understanding what the real lived experience of service users is like, and are they able to readily access the services they need, and do those services work together in a manner? Now, the work that we're looking to undertake is a big commitment, not in terms of costs, in terms of time, we've said 2 or 3 years. And so initially we're conducting a scoping phase, which is ongoing right now, to complete some initial research, just looking at a very high level how services fit together and getting some initial feedback from service users on what that looks like. And we intend to bring a full proposal in detail of what the intervention would look like back to the board in September. In section 4.4 of the report, you've got what services will be provisionally in scope, but what we find over the summer in looking at these areas will dictate whether other services are included or added on as we move through. Now, scoping is a little difficult in the current context for 2 reasons. Firstly, in order to scope services, ordinarily I would personally visit a service and watch how it responds to receiving customer demand and learn about the sorts of questions that service users are asked and how they access services and whether they experience any difficulties in doing so. Obviously, in the current climate with COVID, that is difficult because most services are operating with reduced headcount in their buildings or with temporary access arrangements. That's not insurmountable, but discussions are ongoing as to how to make that happen. Secondly, and more importantly, and going back to the underlying hypothesis of the work, is that individuals with complex needs access multiple services at the same time. You immediately hit a barrier in terms of information governance, because obviously, ideally, what you want to know is for any given individual, what range of services have they accessed over time, what were the timelines of each of their interactions, and how did that play out. Now, obviously, we don't have the consent of those individuals or any individuals at the moment to do that. And so discussions are ongoing with all the various parties involved as to what form of consent we would need to approach individuals with to make that happen and stay within the law. In the meantime, as it notes in the report, we've been working with colleagues at Society of St James SSJ to ask their recovery workers to speak to individuals about their experiences. And the questions that we've been asking, it's literally a 5-minute conversation, are set out in the appendix, essentially asking for users to tell us what services you've accessed over time. Now, that will be reliant on individuals' memories of services they've accessed, what labels they give to particular services and so on, but it should at least give us an initial steer on whether we're in the right areas and whether the combinations of services set out in the report are broadly accurate for the time being. As I say, we'll be back in September with a very detailed proposal on what this is actually going to look like, and you can give us a steer as to whether we're in the right lines at that point. In the meantime, conscious that you've got 3 minutes left in the meeting, I'm happy to take any questions.
Thank you. Any comments or questions? Councillor Smith.
Yeah, a question for me is, why is this a systems thinking initiative? Because that's not very good for dealing with people services, but why has it gone through there, and how does it link into the strategy that we talked about at the beginning of the meeting, because it seems to be covering the same thing?
I'll take the first part, and hopefully Lisa will answer the second. Appreciate the comment about systems thinking initiatives. I think if it's done in the kind of very mechanical way, that some systems thinking approaches are more useful for transactional services. However, the way that we now do that work, we've applied it in many people-based services, including in substance misuse in the city 3 years ago, and we're able to frame the work around the lived experiences of individuals and do so in a way that made the service more responsive to individual needs. And I think colleagues from Society of St James would certainly agree that that was successful in doing so. I don't know if Lisa can come back on the link to the strategy.
Yeah, hi Jeanette. I think you can. My connection is terrible, by the way, and it may be that you can't hear me. So just tell me if you can't. But Matt Gummerson's presentation references this piece of work. It's a piece of work that we've sort of started 2.5 years ago, really, and have been trying to sort of get it going again recently. So it's certainly linked into the health and wellbeing strategy, and I wrote a bit for Matt to go into that strategy.
Thank you.
Okay. Yeah, thanks for both of that. David, can you actually send me the outcomes from those previous ones then? Because these things are done in isolation and we never seem to get any outcomes about what the benefits are.
Jeanette, I can send you some stuff on that as well, because the work was done as a result of the previous work that's referenced in this paper. It talks about previous work that we'd done, and as a result of that work, the SSJ intervention, which I was involved in, happened over a period of 18 months, and I'm very happy to send you the updates. Dave was the lead interventionist there, and it worked really, really well.
Yeah, thank you.
Okay.
Just to come back on Councillor Smith's question, I'm happy to provide any information on previous work we've done, and also happy, Councillor Smith, to talk you through in detail via a call or whatever, because it will probably produce a lot of further questions.
Yeah, that's fine. And as you both know, Lisa and David both know, I'm very suspicious of systems thinking anyway. So it's a bit of a red flag that one. So yeah, anything we can do sort of separate to this meeting would be great.
I'll be in touch.
Thank you very much. Any further questions or comments? No, thank you very much then. So that brings us to the end of the meeting. Before I close though, I did want to just acknowledge that this is Alison Jeffrey's last meeting with us before she takes up her new post in East Sussex, and on behalf of the board just really wanted to thank her for all the work that she's done for the board, but obviously for the children of the city and the families in general. It's been a pleasure working with you, and hopefully some of the ideas and initiatives you started we will continue to grow and develop. And wish you all the best for your new post.
Thank you very much, Chair. That's really kind of you, much appreciated. I've had a fantastic time here, worked with some amazing people, got a brilliant team, and that team will continue to do great work, I know. And the partnership around the city will continue to be fantastic.
Thank you. So the date of the next meeting is the 22nd of September at 10 o'clock. And then the one after that is November, and they will again be at 10 o'clock. I assume we all know in future whether it will be back in person by then or not at some point over the next couple of months, but we'll let you know. Thank you, everyone. Did you want to stop recording, Anna?
Yeah, I'll do that. You'll still be audible for a couple of minutes.
Thank you.